Hey, Dr. C here with you. So what are the best supplements to take for Hashimoto's? And this is important because this is a real thing. This is an autoimmune condition. And all too often people think that thyroid meds are the only solution. And you can take meds like what your body makes, but it's not the same thing as your body making them. And there are natural solutions. There are ways to safely heal and recover from this. And supplementation is well documented to be an important part of this solution. So briefly, what is Hashimoto's? How does this differ from hypothyroidism? Well, Hashimoto's, kind of an odd name. Hiroko Hashimoto was the doctor who found this back in 1907. This is an autoimmune state in which the body's immune system damages structures within the thyroid and leave it less able to function properly. And what we've learned is that this causes symptoms in two ways. The rarer of the two is by a simple lack of thyroid hormone. That might be surprising, but that's the least common way in which Hashimoto's causes symptoms. The most common way it does is by the immune attack itself. So these structures within the thyroid are not just within the thyroid. These same chemical compounds, these proteins, when they're being attacked by the immune system, a lot of other stuff is too. And in many ways, the body chemistry does not work well. And yes, that does correlate with a long-term risk of the thyroid slowing down. But the degree to which the thyroid slows down that dramatically is not very common. So people often try to work at boosting thyroid hormone through medications or whatever else, and the real core problem is the autoimmunity. So what's a role for micronutrients in this case? Well, I've made a whole line thyroid-specific formulations because it's not the same as your needs for supplementation otherwise. And a lot of things that work fine in general don't work great when you have thyroid disease. One of the biggest examples here would be iodine. You really need to avoid this. So the things the body attacks in the case of Hashimoto's, the two big things are thyroglobulin and thyroid peroxidase. Thyroglobulin is a protein on which we store iodine. The more iodine is there, the more it's irritated. It's just like pouring bleach on it. It's a sanitizing molecule like bleach or peroxide. And thyroid peroxidase, its job is oxidizing iodide into the more active iodine. And when there's too much there, the body blocks that. And that's why iodine worsens thyroid peroxidase levels and why they cause symptoms. Another big thing to think about is synthetic B6. We call this pyridoxine hydrochloride. There's lots of data saying that if people have thyroid disease, they can't activate this well enough. Their liver can't convert this into pyridoxal 5-phosphate. When they don't convert it, it's a big driver of nerve pain, anxiety symptoms, tremors, fatigue, and quite a bit else. And last big thing to mention is synthetic folate. There's a lot of data saying that those with thyroid disease almost universally have variations in how they metabolize folic acid compounds. This is the whole MTHFR gene variation, methylation type issues. Synthetic folates create a whole host of digestive symptoms, IBS, gas, bloating, upset, and may be a factor with higher risks for colorectal cancer as well. So what else is different about those with thyroid disease? Well, essential fats, you need them. These are great things that regulate the immunity, they lower inflammation. The trick though is that the most biologically active ones come from fish oil, and they can easily be laden with iodine. So in thyroid-specific formulations, we use fish oils that are assayed to be low enough in iodine and safe enough for appropriate amounts. Vitamin D is critical. The body needs different amounts, not the same for all people, and you can get too much. You don't want to be deficient and you don't want to be at an excess. When there's too much, the body raises levels of calcium, and that drives calcification reactions, which are problematic with thyroid disease. You need adequate magnesium, a critical micronutrient that is commonly low with autoimmunity and worsens the whole process. Calcium is important. Those with thyroid disease have greater risks for bone loss. And then also a lot of diets will avoid dairy because dairy is too high in iodine. So for both of these reasons, calcium is especially critical. And then finally, calcium can disrupt absorption of thyroid meds when used in the wrong types, the wrong timing. Some other things that may help, with Hashimoto's disease, it's critical to calm the immune response, and antibody support is made for that purpose. This is a blend of a special subspecies of Nigella, also called black cumin. Not all black cumin is the same. that this is the subspecies clinically proven to lower thyroid autoimmunity. It's combined with inositol and selenium. All three of these independently have had high-quality human studies showing that, better than placebo, they calm the overall immune response and decrease symptomology with Hashimoto's. So critical, well-documented, safe, and well-tolerated. Another thing to think about is nodule control. There is a high rate of thyroid nodules present in those with thyroid disease. And it's important because 3 to 7% of these nodules are cancerous and can develop into thyroid cancer. Thyroid cancers are the fastest increasing type of cancer among women in North America, and they're more common for those with autoimmune thyroid disease. So what does overall supplementation look like? I made Thyroid Daily as the core blend of micronutrients. So everything in there, the amount, the type, the quantity, is specifically designed to help those with thyroid disease, autoimmune thyroid disease. That's the first step. That combines with Omega Pure and calcium magnesium to make the Daily Reset Bundle. Those are foundational micronutrients for anyone with thyroid disease. And all the other TSF formulations are made with the assumption that those are already being taken. Now, I did that because otherwise there's a lot of ways in which for antibodies, for nodules, that micronutrients can help. But if I put all the micronutrients in all of those and you're on multiples of those, you get too much. And this is a thing that I really want you to hear about vitamins and minerals. They're appropriate, they're helpful, they can be safely used, they can be well documented to be effective. But it's a sweet spot. And when you go above the sweet spot, they don't work. Too much is not better. Of course, there's a point where too much is toxic, but much more common is that people take enough to where they're less effective. And if your dose is higher than you need because everything's being combined in ways that weren't thoughtful, it becomes less effective. So the protocol is start with the Daily Reset Bundle. That's your foundation. And with autoimmunity, by definition, you'd want antibody support. So those serve as the real basis for benefiting Hashimoto's. And these things work in a lot of ways by desensitizing the body to the inflammatory effects of iodine. So it stands to reason that if there's less iodine coming in, it'll all work better. So this is best done in the context of the thyroid reset diet. And it's not to avoid all iodine. You can't, and you wouldn't want to, but it puts you in that sweet, safe iodine window where you've got an amount that when you want it to be low enough during that reset phase, you've got a good chance of healing poor thyroid function. And once you've healed and recovered, you can then do that maintenance stage, which is broader and easier, and that can keep those gains. You can stay at a healthy, safe level. So Daily Reset Bundle, Thyroid Reset Diet, Antibody Support with Hashimoto's, consider nodule control. And another big thing to think about is iron levels. They are often low with Hashimoto's. Many have poor iron absorption or high iron losses, and that worsens the symptoms and worsens the whole usage of thyroid hormones. So do consider your iron status as well. If that's low, Easy Iron is made to help. So that's a quick primer on easy supplementation to help Hashimoto's. And these things make a difference. We see this every day. Antibody levels come down. People feel better from that. They need less medication. They can function like they should again. And that's the whole point.